Hi, this is Steve from Physiotherapy. We're going to demonstrate another exercise with Katrina standing up against the wall, and she's got some TheraBand around her thigh muscles, as you can see there. Now, this exercise again very good for the stability of the hip and pelvis. So Katrina, just show which areas we're going to be working. So just through the back and the gluteal muscles, so just round through that area. Now this exercise can be used to stabilize that area as well as for people who have patellafemoral or kneecap pain, because what we do know is that we can strengthen those stabilizing muscles. You will take pressure off the knees. So this exercise is done with the band around just above Katrina's knees, with Katrina standing up against the wall, as you can see, feet nice and hip width apart. And what I'm going to get Katrina to do is squat down to about 30-40 degrees. So you can see now she's squatted, and in that position she's going to open her legs up and push outwards. And you can see how, and then hold, and then release slowly, and back to neutral, and push outwards, and back to neutral. And again, keep going, Katrina. You can see the feet will rotate outwards, but that's okay. What's important is that she's stable through the hips, okay, and that you're opening and activating those stabilizing muscles. You will feel a little bit of pressure through the knees. However, you don't want to feel too much pressure. If the knees start hurting, then you are either activating too much through the knees and you're not working the correct muscles, or you're squatting too deep. And you can see that Katrina from the side, you know, we've got her squatting down to about 30-40 degrees of knee flexion. And I'd get Katrina to do 3 sets of 10 of those a day. Probably hold that position for 3 to 4 seconds, maybe a bit longer if you like, and then come back to neutral. This is Steve from Physio for All. Revitalize, bounce, and be healthy.